By the end of this video, you will be able to identify 5 elements of high-quality CPR, identify and correct common mistakes students make when performing CPR, and help improve your ability to provide feedback to the students you are training. High-quality CPR is critical to survival of sudden cardiac arrest. With about 500,000 cardiac arrests each year in the United States alone, it's crucial you reinforce the importance of high-quality CPR. Early high-quality CPR combined with early AED use can dramatically increase survival of cardiac arrest to nearly 40%. The first element of high-quality CPR is to minimize interruptions to compressions. It takes several consistent compressions to get oxygenated blood flowing to the victim's brain. Interruptions to compressions, even for just a few seconds, negatively affects outcomes. Use a stopwatch to limit hands-off time for rescue breaths to less than 10 seconds. Additionally, ensure rescuers are immediately resuming chest compressions after AED use. The second element of high-quality CPR is to achieve optimal compression rate. Compression rates in the sweet spot between 100 and 120 compressions per minute are associated with increased survival. Rates above or below the sweet spot reduce survival. Use a stopwatch to monitor compression rates. To remain in the sweet spot, students must complete 30 compressions in 15 to 18 seconds and take no more than 10 seconds to give 2 rescue breaths before resuming compressions. The third element of high-quality CPR is to reach the correct compression depth. Data shows survival is reduced by 30% when compressions are not the correct depth. Data also reveals most rescuers are not compressing deep enough. Instructors should encourage students to press harder. Compression should be at least 2 inches for adults and at least 1/3 the depth of the chest for a child or infant. Mannequins with compression feedback systems, like a clicker or external CPR puck, help rescuers develop muscle memory. The fourth element of high-quality CPR is to avoid leaning on the chest. Leaning on the chest will not allow the chest to expand fully between compressions and will decrease blood flow to the heart. This in turn reduces the amount of blood pumped out of the heart. Ensure students remove their full weight from the victim's chest between each compression. Fatigue often causes the rescuer to lean on the victim's chest, so encourage students to switch rescuers every 2 minutes to reduce fatigue. The final element of high-quality CPR is to avoid excessive ventilation. Excessive ventilation includes giving too much air or too many breaths. Instruct students to follow the compression to ventilation ratio of 30 compressions to every 2 breaths. Ensure students know the volume of breaths should only produce a visible chest rise. Excessive volume forces air into the stomach and may cause vomiting. Observe and provide feedback as needed. Effective feedback is immediate, positive, and constructive. When a student is struggling, allow extra time for practice. Encourage students to ask questions. This will help promote discussion and clear up misconceptions about CPR. Remember, you don't have to know all the answers, you just need to know where to find them. Instructors should feel comfortable navigating the various instructor resources, including the instructor manual, course videos, and the instructor portal. Use the Check Your Knowledge pages in the student workbook to foster discussion and ultimately increase knowledge and retention.